something I would emphasize lastly. And again, I congratulate the Department of Social and Preventive Medicine, Government Medical College, Srinagar, the Department of Health and Medical Education, and Eco India for this wonderful initiative. And I think the timing is very important that we are working at a very crucial and important time when the International Year of Brain Damage Specialists 2026 is slated just 3 years from now, and all the countries are taking regional and national level action. So this is one of the major themes of Food and Agriculture Organization of the United Nations. So I'm very happy that you have taken this initiative, and with this professional approach, I'm sure we'll be achieving equitable tribal health.
Department in collaboration with the hiring of tribal ashas, and that we had to rejig our terms of reference of hiring because we understand that our outreach has certainly improved the hiring, and with the subsequent training and capacity building, we will certainly be equipping our health systems better in terms of our capacity to reach out to such communities. Second,
my information says that tribal communities as of today comprise 8.9% of our country's population, which is significant. The second thing I want to make out, they are widely spread across several states of the country with disparate geography and other patterns. The third thing is these communities live in close proximity to nature. They have all these tribal communities have unique way of living. They have a culture which is rich. They have rich traditions, and while living close to nature, they are at the same time facing a multitude of issues and problems.
Respected principal.
Tribal populations, once we look across the country, we have tribal population interspersed within the community. But here we have a specific population about whom we may be discussing during the course of time and how things have been moving out. The purpose of this workshop would be multifaceted, but once we look at the main objectives of the workshop, it will be primarily on two things. Number one, it will be discussing health and disease of the tribal population across the spectrum. We again thank you all.
Officers giving the lectures on evidence-based management of hepatitis C, asking them that if anybody would like to join me, I will give you free guidance once in a week, one session.
There is no avenue of employment. We don't have to look after the health needs of people. We have to look after the employment generation as well. And if we can generate employment generation through J&K Medicinal Plants Board, and we have this time 3 cultivation clusters in tribal areas. So those things, when you have poverty, you will have the disease, not high demand in Indian industry, they are high demand in European and in USA industry. Used in Ayurveda, now used in Unani, that alkaloid. That alkaloid is used in allopathy for hepatoprotective hepatic disorders, even in jaundice, or even in hepatic of those tribal people. So it's my request that the Eco India, which is doing a tremendous job, you have to, they know the medicinal plants very much. Now we know this time Podophyllum hexandrum has podophyllotocin in that is used in podovart. They knew it hundreds of and thousands of years before that Podophyllum hexandrum is used for warts. And podophyllum, or we have Fratillilia oil, another medicinal plant in this. We didn't